So good afternoon, everybody. Let me do a quick update on testing and cases, and then we'll get into some other issues. Yesterday, the Department of Public Health reported 1,166 new cases. A little over 29,000 tests were reported, and over 8.4 million tests have been conducted since this started. The 7-day average positivity rate is about 3.9%. There are 1,174 individuals in the hospital being treated for COVID, and about 244 are in the ICU. Across the country, states have been reporting increased cases and increased hospitalizations now since Labor Day. The surge was predicted as summer wound down and as people began to spend more time inside. And in the Commonwealth, COVID infections also began to increase rapidly in October. In response, about 3 weeks ago, we made a decision to renew our stay-at-home advisory and ask people to go to work and school and stay home whenever they could. We also ordered early closures of retail, restaurants, indoor recreation, and other businesses where people can gather for long periods of time to cut down on the places and the times where COVID could spread. And over the last 10 days, new case growth has, in fact, slowed down. Also, over the last 10 days, Massachusetts' positive test rate has stayed just under 4%. At the same time, we recorded some of the biggest days of total tests administered since we began testing. We continue to lead the nation as a tester, but the volume of tests the testing sites processed surpassed all of our previous high water marks. And while it's only 10 days, the slower case growth and steadier positive rates are an improvement compared to the sharp increases that we saw the few weeks before that. Didn't happen by accident, and I'm asking everyone to continue to do their part to slow the spread. As we've said before, hospitalizations have been steadily increasing, which is not surprising given the rise in cases, and on average, hospitalizations have been growing at about 2.5% per day for the last couple of weeks. Make no mistake, there's still community transmission of COVID-19 in every part of Massachusetts. Thousands of people are contracting and possibly spreading the virus, and people are being sent to and cared for at our state's hospitals. And every day, the number of people in Massachusetts who become unable to breathe on their own end up in an ICU. And while far less common, too many of our fellow residents are losing their lives to COVID as they did in the spring and throughout the summer. I think we all know that especially at this time of year, it's hard to stay home and avoid groups and get tested and keep your distance, but those are the things we need to do to continue to stop the virus. Everybody has to keep doing these things because we know that they work, and the idea here is to keep everybody healthy and to keep our schools and our economy going forward. Certainly fair to say that with all the work that's been going on around vaccines and other issues, there is a light at the end of the tunnel. But that's all the more reason at this point in time, as we head into the holidays, to dig a little deeper and continue to make the difficult choices that the vaccine and the times require. There's also been a lot of misinformation going around about things that are going to get shut down here, there, everywhere at a moment's notice. People have enough stress in their lives without having to deal with the rumor mongering. Remember to get your information about what's going on statewide from verified sources like mass.gov or from media organizations. This may come as a surprise, but the guy your sister knows who used to work with a guy who knew your friend, they aren't necessarily up to speed, up to date, or accurate with what they know about what we and others are up to. At this time, the Commonwealth is not planning any additional closures or restrictions. We'll continue to follow closely the public health data and continue to make decisions based on that. The public will be given, as they have been in almost every instance and circumstance since the beginning of this, clear notice before anything new goes into effect. We do believe that there are brighter days ahead, particularly as we await the movement with respect to the development and approval of a number of vaccines, which is encouraging news. But in the meantime, we still need to do the things that so many people in Massachusetts have been doing and doing well for the past 10 months. I do believe if we continue to do those things, we can fight off this insidious virus and get through the holidays. Now, speaking of the holidays, I do want to talk a little bit about houses of worship. The COVID Command Center, as most people know, publicly reports robust data on COVID spread, giving residents, the media, researchers, and local officials and state officials detailed information on what's up with the virus. We've been refining this data throughout the pandemic to help inform our response to COVID. In October, DPH began including a weekly cluster report and has a team of dedicated epidemiologists who work to track and analyze them. This team has found that most of our cases arise from household spread and informal gatherings where people are letting down their guard, particularly when they're with people they know. But there are other sources of spread as well. We recently discussed youth hockey and several other establishments that have been linked to COVID-19 outbreaks. When we detect possible patterns like this, we deploy that team of epidemiologists to do a deep dive into the data. The team recently completed a close analysis of clusters from places of worship after local boards of health reported several outbreaks occurring in communities around Massachusetts. Now, we know that houses of worship have always served as a place of refuge, especially in difficult times like this. And I remember way back when in March, when we first started talking about our original stay-at-home advisory, how difficult it was for the Lieutenant Governor and me to include places of worship as part of those decisions. And during this time especially, as we head into this holiday season of faith and hope, houses of worship play an enormously strong and important role in many communities and in the lives of individuals and families across the Commonwealth. But as with all gatherings, protocols have been put in place to ensure that services and other functions that happen in houses of worship happen as safely as possible. And the Commonwealth's faith leaders have responded admirably to the COVID-19 pandemic. Many have moved their services online, allowing members to still tune in every week and from the safety of their home. Some have adapted to holding outdoor services or added partitions to listen to services from their vehicle in the parking lot outside. But our data still found that there were too many clusters of cases that stemmed from houses of worship, and these cases spread out into the community at large. Since the start of COVID-19, houses of worship have experienced a total of 36 clusters. Those clusters have led to 316 confirmed cases and 150 total close contacts. 48 Massachusetts cities and towns have had one or more confirmed or probable COVID cases associated with a place of worship cluster event. That by itself is pretty extensive. In the last month alone, places of worship saw 6 clusters with 44 confirmed cases and 22 close contacts. In one of these clusters, contact tracers reported over 200 positive cases. That's obviously a big number, but what's more concerning is that those 200 individuals went off into their own daily routines where they were likely exposed to numerous contacts in different settings. As we've said many times before, one of the most dangerous aspects of COVID-19 is its ability to silently spread from person to person across groups, especially if people are engaged in informal conversation without masks or distance, and in many cases with no symptoms, the so-called silent spread. Contact tracing helps us follow the data to get a picture of how far this virus can reach. In this particular case, about 90 businesses and organizations were exposed as a result of those original cases, and possibly more. Of those 90 organizations, 23 then had clusters of their own arise. That cluster led to over 40 cases at a local university, which came through 2 different chains of contact from 2 attendees at that house of worship. We all know that COVID is contagious, and we all know data like this shows just how quickly a cluster can spread, infect others, and create other clusters. For many reasons, from holidays to funerals to weddings, houses of worship are often the setting for group gatherings, as they should be, have been, and will be. But this holiday season is special for many religious organizations, and they have many additional services and community gatherings, as they always do. Most families have long-standing traditions anchored around their church, their mosque, their synagogue. But we know that this year, it should and will look and feel different due to COVID. And we continue to ask all of our faith leaders and residents who practice to engage in safe policies, protocols, and procedures. Many have moved remotely, as I said before, and that's certainly positive. But I think it's critically important, if you do attend an in-person service, please do wear a mask, keep your distance. Remember that in-person gatherings, especially indoors, have an increased risk for COVID spread. If you're hosting an event, like a wedding, please consider keeping your group small to avoid the risk of transmission and follow the rest of the rules. We know that it's difficult to ask people to modify these time-honored traditions, but COVID has no intention of taking the holiday off, and in many respects, it's many of those time-honored traditions that create some of the most significant issues with respect to spread. Now, we talked a lot about this before the Thanksgiving Day holiday. And the Lieutenant Governor and I and Secretary Sutters were pleased to see that airline travel year over year was down about 60%. Bus and train travel over the weekend was down about 80%. And automobile travel was down about 5 to 8%. Now, we weren't pleased about that because we thought it meant everybody had a great holiday. We were pleased by it because it meant that many people understood that this year, that Thanksgiving Day event, that Thanksgiving weekend needed to be different. We also heard from many of the folks who sell turkeys that the small birds went fast, and in many cases they had big birds left over. Another indicator that people did smaller gatherings than they have historically in response to COVID and to the messaging that came from so many of us. Now, I get that after 10 months of fear and anxiety and tragedy and sacrifice and uncertainty, as we head into this holiday season, the one place most people want to be, for very good reasons, is with their family, participating in many of those rituals which involve formal and in some cases informal gatherings that we all love so much. And what we're really saying more than anything to people is recognize and understand that if you're going to get together with people you don't normally spend time with, be safe. Wear the mask. Encourage them to wear the mask. Keep your distance. Wash your hands. Don't share food and beverage. And treat it a little more formally than you might normally. This isn't, hopefully, a forever thing. But when you're in the midst of the kind of surge that we and so many other folks around the country are in, it's important for people to keep their guard up in almost every social circumstance and situation, no matter how valuable and important that particular gathering or that ritual can be for you or for members of your family. I also want to give a quick update on some new supports we're providing for long-term care and nursing homes. As COVID-19 cases rise across the state, we've seen an increase in clusters at long-term care facilities. Since the spring, we've implemented accountability measures and provided significant support to this community. That's included over $400 million in additional funding, rapid response teams to provide staffing support, state-funded surveillance testing for staff and residents, PPE, and regular infection control surveys. Facilities are currently in a far better position to respond to COVID-19 now than they were in the spring. And that's illustrated in many respects by the fact that in the spring, folks over the age of 70 represented about 20 to 30% of all of our positive COVID cases. They've represented about 8% since Labor Day, and that number hasn't moved hardly at all. However, with the new outbreaks and the growth in cases overall, we have seen an increasing number of facilities requiring temporary urgent staffing support due to staff testing positive for COVID. To help with these staffing shortages, we'll increase the number of rapid response teams that are available to support long-term care facilities from the 8 we currently have on the ground to 14. Each rapid response team includes, on average, 10 clinical staff that can support direct care, infection control management, and PPE coaching. These additional 6 teams will be available by mid-December, and in the meantime, the Massachusetts National Guard will serve as a bridge to provide clinical staffing supports to facilities with urgent issues and concerns. About 80 members of the Guard are ready to be deployed by the end of this week. And all of those members of the National Guard teams have clinical training. 2 Guard teams will be deployed to 2 nursing homes early this week and to support direct care staff. The National Guard will provide supports through at least the end of December, and will reassess the long-term care facility needs at that point in time. And as we have seen demand for rapid response teams shift over the course of the year, we've adjusted the number of teams available to provide these supports, and will continue to ensure that these supports are available for facilities that have the biggest concerns and greatest need.